Welcome back to our show, and today I have with me Jomo Phillips, couple and family therapist. Welcome, Jomo.
Thanks for having me.
It is so great to have you here. I was supposed to have you on the show for a while now. We had a few rescheduling things, but I'm glad that you're here today, and today we're going to discuss men's mental health.
Of course, which I think is a pretty important topic.
Yes,
actually.
it is. So, I want to begin first with having you introduce yourself. I like people to, speak about themselves. So tell the public a bit about who you are and what you do in your practice.
I'm a couple and family therapist. I'm also a clinical social worker. I work with a variety of clients. I work with individuals. I work with couples. Most of my work currently is around couple work and serving couples who are experiencing some type of distress. I also work with families as well too. And I have a special interest in terms of serving men. For many years I worked at Verdon House as one of their couple and family therapists. And in their men's programs, I've always been very interested in, particularly in terms of how men get represented in terms of mental health and how can we sort of encourage men to better be able to access mental health services as well.
Okay, brilliant. Okay, and that's one of the reasons we have you here as a guest on the show, because we find that with men tend to present a little differently than women when it comes to depression.
Of course.
Women generally are a little more outspoken and they readily ask for help more so than men. So going into that, let's talk a bit about general mental health right now, and then we'll segue into men's health, mental health specifically. So right now, with everything that's going on in the world, everything that's happening, everyone's mental health is affected in some way. We have lockdowns, we have things changing, different regulations, different restrictions, and all of this can play on a person's mental health. Sometimes adversely, or more often than not adversely. So what would you say are some of the coping mechanisms that all people can use when they find that their mental health is not to the level where it should be?
Right.
Yeah.
Well, I'm just thinking about your question. I think it's a nice, good question in terms of thinking about just what this pandemic has meant for people in terms of mental health. I think we've had a crisis in terms of social disconnection, and that of course leads, because we're naturally social beings.
Yes.
That social disconnection and that isolation leads to mental health distress. So I think definitely one of the things is for people to remain sort of connected to others. And I think unfortunately, based on the fact that we have social distancing because of the requirements of the pandemic and keeping people safe, we're going to need to think about social connections in different types of ways.
Okay.
I mean, for one, in terms of connection, making sure that people remain connected online. People remain connected as well too in terms of being able to reach out and connect with others, in terms of telephone calls, in terms of social media, in terms of being able to use Zoom so that they remain connected, and also just in terms of being able to just sort of regulate yourselves.
Okay, so most importantly is to know that they're not alone, right? Because literally people have had to isolate themselves from others because of this pandemic. And using myself as an example, I know shortly after we came out of lockdowns and I had to interact with people, it was almost like I had to relearn social skills. It was so weird.
Yeah, of course.
It was so weird. And I'm the type of person who can talk to anyone, before a pandemic, but because I was more or less isolated for so long, when I started interacting with people again, it felt strange. It didn't flow. It didn't come as naturally as it did before. And I know I'm not the only person that's unique in that experience. So it's almost as if it's a muscle that has atrophied. Our social skill is a muscle that has atrophied, and we now have to learn to work that muscle again. So I think it's very important for people to find healthy ways to reconnect and to stay connected, because it's very important to know that you're not alone. You're not alone. Now, going on to men and depression, or men's mental health, I should say, because mental health is not just depression.
No, it's actually quite a broad label.
Exactly, it's a big spectrum, so I caught myself there. So let's speak about men's mental health. We're in Barbados currently, but in Barbados and the region, what support systems are they that you're aware of, being in the field that you're in, to assist men with their mental health, keeping their mental health in check?
I think part of it is that we have a number of systems already in place for people who are experiencing mental health distress. And I think I can talk, for example, about Barbados. I think we've done a pretty good job in terms of making community resources available in terms of mental health services. So one of the things, or one of the good places that mental health services are available is in our polyclinic system. Of course, we have some specialized centers as well for mental health, which includes a psychiatric hospital, and we have a specialist ward at Queen Elizabeth Hospital for mental health as well.
Oh, okay.
Yeah.
Let's elaborate a bit more on the resources at the polyclinic, because some people may not even be aware of this. I know a lot of people are aware of our mental hospital, and they may know about QBH, but could you tell us a bit more about what help they can get at the polyclinics?
And I think it's sort of connected to a movement with regards to mental health, and that's a whole idea of moving mental health away from institutions into the community, and there's a reason for that. One of the reasons for that is addressing the issue of stigma and discrimination. And very often people have experienced stigma visiting a psychiatric hospital, and that may also prevent people from being able to access services.
Okay.
So people can call the polyclinic, or they can visit the polyclinic, and at a number of the polyclinic systems here in Barbados, there are psychiatrists who are there, and there are also mental health nurses who are there as well too. And there are also some psychologists as well.
On staff. Perfect. Lovely. What would you say are some of the unique challenges men face when it comes to mental health?
I think one of the things for sure is the whole idea of masculinities. Actually, I like to use the word masculinities because there are multiple ways that men learn to be men. And we sort of see that get represented in a number of different types of ways. One, in terms of how men experience mental health distress. So you used the good example of depression earlier. So men who are depressed may look different in terms of how they present compared to a woman who may be depressed. So women tend to internalize, for example, with depression. So they may tend to withdraw. Men tend to externalize when they're depressed. So they may be more angry, they may be more aggressive.
So a lot of the times, based on what you just said, a lot of the times when we see a man acting out or acting up, and I guess this could present itself or manifest itself in like risky behavior. Maybe he might go there and drink, maybe he might go there and have sex with, someone, unprotected sex, or have numerous partners. It is not necessarily him being promiscuous, but this is his way of dealing with those feelings.
With that low mood.
With what's going on inside. And it begs the question, are enough men introspective enough to realize that what they're feeling is something deeper than what it's presenting itself as? And by that I mean, if a guy is going through something, the society that we're in, is there a space for him to feel comfortable enough to be aware of what he's feeling, to recognize, okay, this is not just me wanting to go and do something risky. This is me not wanting to confront what I'm feeling, so I'm going to go and do something risky. Do you think that there are enough safe spaces for men to talk about these things and to realize this is what is happening within their community?
That's a good question. I think it's how we start to negotiate masculinities. So one of the things, for example, is that men are taught to internalize their feelings. They're also taught that just being able to access help, including mental health assistance, is a weakness. I think one of the things is how do we sort of socialize men to challenge that, some of the ways that they've learned to be able to help themselves and to be able to access help. So part of it is just making men aware that services are available, and that accessing a service, particularly when you're distressed, does not necessarily mean that there's a weakness involved.
Agree completely. And it goes back to like growing up, you would always hear like little boys and little girls are playing, and maybe the little boy falls and he cries, and you would always hear, "Oh, you're not a girl. What are you crying for? You're a girl." Like these things, they're socialized in our men from young, especially here in the Caribbean region. So what do you think are some of these things, or what advice would you give? Because we have to start with the little ones coming up. Adults need help as well too, but I always find that prevention is better than cure. So what advice would you give, I would say, to the parents out there, tips in dealing with their young boys, their young men, their teenagers, to help them identify with their masculinity and to understand that masculinity is multifaceted, it's not just one thing.
Excellent.
Yes. What advice would you give?
I think part of it is, just as you said, is a parenting piece. And part of that parenting piece is recognizing that young boys do have feelings, and we want to create safety so that they can share what it is that they're actually experiencing. So we want to create safety, but we also want to give them permission in terms of sharing what it is that they're experiencing as well too.
Okay.
Yeah.
Great. Thank you. What I'm going to ask you, as a man yourself,
First,
how do you take care of your mental health?
I think one, I think being sort of connected to my partner in terms of talking about what I'm experiencing, but also having good male friends that I can also talk to in relation to just my own experience. But I think women have different understandings and different experiences,
Yes,
and we also want to have people who may understand or get where we're coming from. So we also want to have a community around us as well.
Yeah, so support systems, you would say, are very important.
Yeah. And I think the other piece as well too is also being able to look after yourself.
Yes, definitely,
Yeah.
definitely. What I want to do now, I want to go to this article that is on the website, American Psychological Association's website, and the title of it is Men, a Different Depression.
Right.
So I'll just read a little part of it for our listeners
Please.
so that they can just get a little insight into how depression specifically would affect men
Right.
compared to how it affects women. But again, like we said, there's more to mental health than depression. Right. So, it says here, according to the National Institute of Mental Health, about 6 million American men suffer from depression every year. Yet, psychologists know that men are far less likely than women to seek help not only for all mental health problems, but depression in particular. And this goes back to what we were saying, that men may be a little more hesitant to get the help they need, and a lot of that is based on your concept of masculinity.
I mean, particularly the idea that you just asking or securing help involves weakness. Yeah, I mean, the whole idea in terms of masculinity is that real men don't
Men
ask
are
for help.
strong, men are, we don't need, not we, because I'm not a man, but men don't need any
Of
help,
course.
they don't need anyone. But the reality is that's not true, and it's not healthy.
Of course.
Okay, it also says that researchers and clinicians are coming to think that the traditional signs of depression, sadness, worthlessness, excessive guilt, may not represent many men's experience of a depressive period. So basically, again, what we said earlier, how they show women internalize, men externalize, it's going to be different compared to how women would. Although research is just beginning to support the idea of a male-based depression, it is possible that men may instead express their depression in terms of increases in fatigue, irritability, and anger, sometimes abusive in nature, and we touched on that earlier. Loss of interest in work or hobbies, and sleep disturbances. It has also been shown that men use more drugs and alcohol, perhaps to self-medicate. This can mask the signs of depression, making it harder to detect and treat effectively. So I wanted to touch on that part specifically about self-medicating with drugs and alcohol, because this is where, I guess, substance abuse and mental health will intersect. So do you think, based on this and based on what we would have discussed, do you think that a lot of the substance abuse issues that we may be seeing in our society, that it actually may be mental health issues that are masked?
I mean, I can even talk about some of the research.
Sure.
So what we know in terms of research, particularly with people who have a substance use disorder, so that includes alcohol and drugs, so about 90% of people already also have a co-occurring disorder as well too.
Okay.
So some of those co-occurring disorders include anxiety disorders, depressive disorders.
Okay. Now you see, so that's how we tie it all together. So there's more than what is happening at the surface.
And then the other thing as well too is that people use drug as a way to regulate your mood. So if you're feeling down, one way to get up is to use a drug, and that includes alcohol, which tends to disinhibit.
I want to go back to speaking about the unique challenges that men face now, and this again ties in with masculinity. If we think in a traditional way, men are head of the household, and men are supposed to be big and strong, and they don't need any help, they don't need anyone. And using the pandemic as an example, a lot of people, would have become unemployed. A lot of people would have lost some of the resources they had. I guess what I'm trying to ask is, how bad do you think it is, based on everything that has happened? How bad do you think it is? Because I know there are a lot of people who are suffering silently, males, females, children. But do you think we are at a crisis point? Because, again, we were speaking about men not wanting to ask for help. So let's say there's a very low employment rate. These men, they can't provide for their families. You know, they're feeling as if they're not doing what they're supposed to do. Obviously, this is how we would have been socialized. What advice would you have? Like, if you wanted to encourage someone to, I don't want to say seek help, because even with that, there's stigma, especially for someone who is not comfortable speaking about their feelings. I guess I'm trying to say, what resources are available for people, men especially, who may be thinking, I don't have an option to what is going on in my life. I don't have a way out. What resources or what steps would you tell them to take?
Yeah, I think we tend to think about mental health assistance only in terms of going to a professional. I think people can get and experience a lot of relief, and they can also get a lot of help from people who they already know are connected to. So I think one, for going to friends and family members who are traditional supports. And the other thing as well too is going to people who they're connected to with regards to leadership.
Okay.
So I mean, I know a number of men, for example, are connected to church or religious communities. So going to their pastor or going to their priest to have a conversation as well too. And as I mentioned before, I think peers are a really important resource in terms of support. So also just sort of connecting with other men that they have a relationship with.
Okay.
And I know there's some risk there as well too, because we sort of teach men not to be vulnerable, and that includes being vulnerable to each other as well too. Yeah.
Okay. What I think would be so great, I don't know if there are any existing, I haven't heard of them, but what I think would be really helpful to men, and this is obviously coming from my perspective as a woman, but to have their peers, to have like a monthly meeting. You know how guys meet up and they go for beers or something like that? To do that, but to talk about the issues that are bothering them, you know, beyond surface level things, beyond the things that they would normally talk about, like to get really deep with it. If there was a structured meeting like that, I think that
I
would
know
be
one
beneficial.
organization like that.
Okay.
That's men's, men education and support. I think the current president is Fabian Sargent. So I know he's been doing some advocacy work, and they've formed an organization as a way of getting men together and being able specifically to address issues that affect men. And that includes being able to support each other.
Okay, good stuff. Okay, so what I'm going to do, I'm going to break the fourth wall here. Yes. You should have seen my videographer's face. You don't have to come on camera, but we'll hear your voice. As a man, what would you say are some of the challenges men face when it comes to mental health? And what are some of the areas you would like to see improvements in?
Well, it's exactly what you guys mentioned before. I guess the being a tough guy and not talking about our feelings and emotions. And well, you brought a very valid point. Guys tend to talk to other guys, right? And it's a way for us to, I guess, release that emotion, especially if you're close. Well, I'll talk about my experience because I have a close, very tight group of friends who are able to talk freely amongst each other, right?
Right.
But I know there's still the instance of let's go and grab a drink, and then there's still training those substances in there as well.
Yeah.
So I guess I guess it's getting over the stigma of first talking about our feelings and how we as a society also how we view mental health.
Fantastic.
Yeah, that's why.
Great answer. Thank
Yeah,
you.
no problem.
I didn't want to put you on the spot there, but I wanted that pure uncensored opinion.
No problem.
Okay, so I'm going to ask you gentlemen now, as a woman, what is it do you think your partners can do to help you feel more comfortable, to create a safe space for you to share what you're feeling, share what you're going through? What is it that you would like women to do for you to help you?
To listen, to validate, and just start to recognize how important it is for men to be vulnerable. To validate when they hear them being vulnerable. But I think because also in terms of masculinity, it may take men some courage in terms of being able to share. Just also being patient with men as well too, in terms of just when they take the opportunity or take the risk to share as well.
Okay, yes, because anyone putting yourself in a vulnerable position, there is that you know, that fear, you know, am I doing the right thing? Is this person going to use this against me? And to be a man, making yourself that extra vulnerable, you know, I can understand completely as a woman how that would, you know, feel to you. So ladies, if you're listening, that's what the guys need. That's what the guys need from us. So I'm going to ask you to talk a bit about the work that you do specifically at your organization, which is relational practices. So please let the public know.
Yeah, so relational practices is my private practice. So as I mentioned before, Nadine, I consult with individuals, couples, and families. One of the things I'm very interested in, because my training is as a couple and family therapist, I'm interested in terms of the relational dimensions with regards to mental health. So I'm particularly interested in helping people to change their relationships with themselves, but also being able to change relationships with others and to be able to secure support in terms of their own recovery process.
Okay, do you offer services both in person and virtually?
Yeah, right now, actually, since last March, I have been working all virtually. I'm hoping to return back to the physical office soon. But just sort of given the current COVID environment that we're here in Barbados, we'll see.
Okay. Understood. So thank you for that information. And just for our listeners who may not be viewing and they're just listening to the audio, could you give us the telephone numbers of how to reach you at the relational practices?
Right now, because I'm working primarily virtually, 256-4759.
Okay, and that's 246
Yes.
256. Okay.
Yeah, thank you, Barbados.
Yes, Barbados area code. So repeat it again with the area code for me.
Yeah, 246-256-4759.
And is there an email that they can reach you at if they're unable to call?
Yeah, Jomo at therelationalpractices.com.
Okay, we'll put it up on screen as well for our viewers. So, Jomo, I want to talk a bit about violence specifically. Now, I remember when lockdowns and shutdowns first happened at the beginning of the pandemic, everyone was at home. So there would have been lots of situations where women would have been at home with men who may be abusive. And these men typically, pre-pandemic, would have probably like left the home when they got, you know, angry or they were about to act out, or the lady could leave if she knew, you know, an episode was coming on. But in the middle of lockdown, there was not that option. So let's talk a bit about men channeling their depression or their mental health, you know, issues through violence. Let's talk about that. Let's talk about ways that we can prevent it and ways that we can acknowledge it if it is happening, and resources that are available to these men specifically. Yeah.
I think one of the things for sure is that when people are stressed and people are sort of confined in terms of close quarters, then they're higher risk, particularly with regards to violence. And that includes spousal violence, but that also includes violence with regards to children as well, too. You know? I mean, just because of the nature of the pandemic and the fact that we are in close quarters, particularly inside the same household, those dangers are heightened. I think for sure, one of the things that we need to do is that we need to educate people about alternatives with regards to violence. And now those alternatives include being able to resolve conflict, being able to address feelings, and also just opportunities if there's a situation where things are heightened and there's a risk of violence, the opportunity to be able to walk and go somewhere else.
Okay.
And I know that's exacerbated in terms of difficulty because of the pandemic environment that we're currently living in as well.
And restrictions that different countries, different islands will be facing. Yes, it's tough for everyone. And speaking of everyone, like I said in the beginning, everyone's mental health would have been affected to some degree by this pandemic, whether it be unemployment, whether it be, you know, lack of resources. Everybody was affected. And I want to touch a bit on suicide because people may be, you know, having suicidal ideation or suicidal thoughts. And let's address that.
So I think one of the things is, and this is again in terms of the mental health research, that both men and women make attempts in terms of suicide. And these are when, of course, when people are quite distressed in terms of emotional distress. But men, unfortunately, are often more successful in terms of suicide attempts. And there's a reason for that. One of the things is that men tend to use more dangerous or more lethal methods in terms of making the attempt to suicide. I think one of the things for sure is what are some options outside of the suicidal route, and for sure it's being able to access help when people are in a suicidal crisis.
Okay. let's talk about that. What are some of the signs to look for? Because a lot of people think that just before a person commits suicide, like they're extremely depressed or they're extremely sad, and that's not necessarily the
Not
case.
at all.
Like research would show that a lot of people who unfortunately were successful in committing suicide, that just days or hours before they were like in extremely good moods, you know, extremely happy. And then their loved ones after the event would be like, you know, they were fine or they looked fine.
Right.
We don't understand how they could have done this. So please let the public know what are some of the signs that you can look for in your loved ones that may indicate that they're thinking about suicide or they might be close to, you know, committing the act.
I think you just raised one that was important. When people are very depressed, they usually don't have energy to even get out of bed. Is when mood starts to lift that people may be more energized and they may actually have the energy in order to be able to harm themselves. The other thing as well too is that there's some other classic signs. One, I think, is important to listen to the language that people use. So people may make direct statements with regards to the fact that they're going to kill themselves. You're not going to see me around. You know, today's going to be the last day you see me. Those statements need to be taken seriously. And there's some other things as well too. You know, when people are giving away things that are important to them. When they're behaving in ways that are quite strange.
Okay.
Yeah.
So when they're acting out of character, and this could be subtle or this could be
of course.
overt. Okay. All right. Because I find that if you have a loved one who's in distress, it is always better to, I'd rather offend someone by asking them, you know, if they're okay, if they need me to help, how can I help? I'd rather possibly offend them than to not say anything and then, you know, they commit suicide.
Right.
Because
And I
once
think
they're gone, they're gone.
And I think that's a really important point as well. I think people usually are very fearful of asking if somebody's suicidal because one of the ideas that people have is that it's going to put that idea in the person's head. What we know is that when people ask, it usually provides people with a lot of relief because it gives them permission to be able to talk about what it is that they're actually experiencing.
Yeah.
And hopefully the beginning of getting help as well too.
So it cannot hurt to ask.
No, not at
cannot
all.
hurt to ask. It actually would hurt to not ask.
Yes.
Okay, lovely. I want to also touch again on resources because I think it's very important to those listening, especially the men and especially the people supporting them, to know what resources. So you would have spoken about your organization. Mention for us again some of the resources available to men in Barbados and in the region that you're aware of to assist them with their mental health.
For sure, in Barbados, our public health system, including our polyclinic system. We also have the psychiatric hospital, which is a general psychiatric facility. And people can also, if there's a mental health emergency, can also access by calling the ambulance. They can go to accident and emergency, and be assessed and be able to provide with assistance. If they need to be referred to the ward, then they can be able to access that as well too. And of course, we have, I think one of the things that's happened in the community is that we have a lot more private mental health resources that are available as well too. So I can talk as a private mental health clinician, but we also have a variety of people who are providing mental health services too.
Okay, what is the name of the organization that all therapists and psychologists are under in Barbados?
So we have a number of different organizations.
Right.
So there's the Barbados Psychology Society, for example, for psychologists. There is the Barbados Association of Professional Social Workers for social workers. And we also, as a family therapist, we also have a fledgling organization because in addition to myself, there are a couple other family therapists on the island as well.
Okay, lovely. Right, and they can also reach out to you at the relational practices. Again, we would have that information up on screen. And just repeat the number for our individuals.
246-256-4759.
Lovely. Thank you so much, Jomo, for coming and being our guest today. You were very insightful and knowledgeable. And I hope the information we shared here today can help someone who's listening.
Thanks for asking good questions.
Thank you. You're welcome.